Good afternoon, everyone. My name is Kathleen. I'm an occupational therapist and certified hand therapist with Spear Live. I'd like to welcome back those of you who have attended one of our other webinars, as well as welcome those who are joining us for the first time. We appreciate you taking time out of your busy day to learn with us. So for those of you who do not know who we are, Spear is a private outpatient practice. We've been around for over 20 years, and we currently have 21 locations all over the New York City area. We've successfully continued to offer in-person care throughout the COVID-19 pandemic, and have also launched Spear Live, which is our telehealth platform for those who are looking to stay in and receive care from the comfort of home. In our clinics, we are strategically going above and beyond the CDC guidelines to ensure the safety and well-being of everyone. You can find more detailed information on those safety measures by visiting our website, which is spearcenter.com. At Spear, we're here for you in whichever way makes you feel the most comfortable. If you're looking for individualized care, either in the clinic or through telehealth, please reach out to us at your earliest convenience and we'll get you set up with an appointment right away. So we're excited to be with you today to discuss lymphedema and how to treat it from home. In this course, we're going to be reviewing lymphatic system anatomy, pathophysiology, and lymph management interventions in populations living with lymphedema. So as part of our session today, we're going to be talking through and demonstrating some of these techniques. We welcome you to follow along and practice with us if you feel comfortable, but please note that if you're experiencing any pain while performing any of these, and or if you feel unsteady or unsafe to do them on your own, please stop and reach out to us directly and we can support you. So as you can see, some of us are coming to you from their Spear locations or home, and although we don't anticipate any technical issues, please be patient should any arise and we navigate working through technology. All right, so a little bit of housekeeping. So throughout the webinar, we want to hear from you. If you have any questions, please feel free to let us know your thoughts in the Q&A feature. So where you find that, just take a moment and hover your mouse over the bottom of your screen. You're going to see a Q&A option pop up. That's where we want you to put the questions. We'll do our best to address as many of them as we can during the webinar, but it's best that you put those questions in the Q&A rather than the chat feature so we can make sure that we see them. For those of you watching through YouTube Live, we are also monitoring the comment section there, so feel free to type in your questions on YouTube as well. And then lastly, there's going to be times where there's multiple panelists on the screen. So for your best viewing experience, please select gallery view at the top right corner of your Zoom screen, and then you'll be able to see multiple panelists at one time. So let's talk about our goals for today. We're going to be covering the following. So we're going to identify key anatomical structures and functions of the lymphatic system, recognize pathophysiology of lymphedema, review evaluation and treatment of lymphedema, including manual lymphatic drainage, patient education, and volume management techniques. So before we get started, I want to introduce you to our team of panelists today. So we're going to welcome everyone onto the screen. And I want to introduce you to our presenters first. So we have Awana Kardai, who is a physical therapist at our Union Square location, and Sean Alasso, who is a physical therapist at our Chambers Street location. And then we also have Sarah Shoemaker, who is our Q&A moderator. She's a woman of many talents, physical therapist, pelvic floor specialist, and assistant clinical director at our Chambers Street location. She's going to be helping us organize the Q&A today. All right, so let's get started. Sarah, Sean, and I are going to say goodbye for now. We'll let you take it away with information on lymphedema.
All right. All right, so let's talk about the lymphatic system function. So what does the lymphatic system do? It's part of the immune and circulatory system. It protects your body from illness, and it helps maintain body fluid levels. It is a drainage system that removes excess fluid from the body and returns it to the bloodstream. It also helps with absorbing digestive digestive tract fats, and it helps removing cellular waste. Now let's talk a little bit more about the anatomy of the lymphatic system. All right, so we have two images on the slide. On the left, we kind of have an image of how the lymph fluid travels through the body. And on the right, we have an image of the lymphatic organisms in the body. So we have the lymph nodes, the thymus, the spleen, and the lymphatic ducts. So let's talk a little bit more about the journey of the lymph fluid. So the lymph fluid within the tissue start their journey back to the bloodstream by passing into tiny lymphatic capillaries that are part of almost every tissue in our body. Once within the lymphatic system, the extracellular fluid called the lymph fluid drains into larger vessels called the lymphatics. The lymph vessels contain small masses of lymph tissues called the lymph nodes, which help remove foreign materials such as infectious microorganisms from the lymph filtering through them. An example of these lymph nodes are the tiny nodules you can feel around your neck, your armpits, and your groin area. The vessels eventually converge to form one of two large vessels called the lymphatic trunks, which connect to the base of our necks. Both of these trunks drain the lymph fluid back to the bloodstream via the subclavian veins. The lymph is transported along the system of vessels by muscle contractions, and there's valves that prevent the lymph from flowing backwards, which is the mechanism we use in physical therapy in order to help manage patients with lymphedema. Now let's talk a little bit more about the lymphedema pathology with Sean.
So as Ioana explained, there are plenty of important structures that the lymph must travel through in order to work effectively. But what happens when there's a break or an interruption in this process? Over time, the protein-rich lymph fluid can accumulate in the extremities, resulting in symptoms that we'll be discussing shortly. Different types of interruptions can cause different types of lymphedema, primary and secondary. Now, primary lymphedema is caused by abnormal development of the anatomy. This can be an absence, a pore formation, or a change in the number or size of the vessels, nodes, or valves mentioned earlier. This type of lymphedema is most commonly seen in extremities, in the lower extremities, as well as in women. Secondary lymphedema, on the other hand, is caused by a force acting on the lymph structures, not part of normal development. This includes trauma, surgery, infection, or a tumor or venous insufficiency developed later in life. This commonly manifests in those who have undergone breast cancer treatments due to the removal of the lymph nodes and radiation damaging lymph tissues, resulting in lymphedema of the arms. At this time, there is no known permanent cure for lymphedema, so the focus of management, as we'll discuss in a bit, is the major way that we treat this condition. Now, as a patient, what would someone experience that would make them think that something may be wrong? And so the common signs and symptoms of lymphedema are, as you can see below, feelings of swelling or fullness of the limbs, tight feeling skin or hard skin that when you touch it, it doesn't really have any give or stretch to it. Changes in skin texture, so that could be bumpiness, dryness, or any other type of change there, as well as ache or pain in the limb that you suspect might be swelling. I've read descriptions of people talking about wearing their rings and them getting tighter without any weight gain. So things just start to fit strangely, or the leg or arm itself will start to feel different to the person who is owning that limb. Now, what are the risk factors for lymphedema? That would be cancer treatments like we've discussed before, as well as trauma to the lymph nodes. So that can be surgical or external trauma from an accident, for example. Now, what can we do about this condition? A patient who receives a lymphedema diagnosis will ideally undergo complex decongestive therapy, also known as CDT. These bullets in red are part of phase 1, when the focus of treatment is to reduce the overall limb volume in order to fit a patient with a long-term compression garment. Although all throughout phase 1, professionals trained in lymphedema management, sometimes called lymphedema therapists, for example, will be treating a patient with the above techniques: manual lymphatic drainage, therapeutic exercise, compressive therapy, and skin care, as well as fostering independence and self-management for the eventual transition to phase 2 of CDT, long-term management. To focus on two of these tactics, I'll now introduce manual lymphatic drainage. Manual lymphatic drainage is a technique used to move the lymph fluid towards points of drainage, i.e. the lymph nodes mentioned before. While the overall procedure is more complex in the scope of this particular presentation, the general principles are as follows. First, we'll work at the core of the body and work out towards the extremities. The reason being, we want to make sure that the lymph that needs to drain first can then allow for room for the lymph that's trapped in the arm or in the leg to then flow towards the core and then away from the body. So this would look like the abdomen moving towards the neck, the trunk, and then the upper or lower extremity. Now, lymphatic drainage is not like a deep tissue massage. Instead, it is light hand brush pressure. So it's more so moving the skin in order to activate the tissues. Furthermore, this technique, so a patient would know what to expect, is about a 20 to 30-minute sequence that can be repeated over and over again. Some indications, in addition to lymphedema, would be chronic edema, venous insufficiency, or a condition called chronic regional pain syndrome or complex regional pain syndrome. Some contraindications that would make you avoid this type of drainage would be congestive heart failure, as this might cause increased fluid to the heart and therefore overload it. Once MLD in combination with compression has brought down the volume of an affected limb, we can further use exercise to assist in the process of management.
All right, so let's talk a little bit about the exercises and how that can help manage lymphedema. So as was discussed in the anatomy portion of the presentation, our muscles act as little pumps which help push the fluid away from the affected limb. An analogy that we could use to imagine your limb is a water hose and there's water flowing freely. When you complete an exercise or you have a compression garment on, it's acting like your thumb would be pressed on the water hose. So the excess fluid is pushed up and out of the limb with a vigorous force, resulting in increased fluid removal and overall decreased lymphedema. Some other general concepts of these exercises are that they are low impact, they work proximal to distal, so close to your body to far away, and it is important to remember to don any compressive garment while performing. So some of the exercise we will be going over today include belly breathing. For the upper extremity, we'll do pectoral stretching, wall slides, towel squeezing, and for the lower extremity, we'll be doing heel raises, alphabets, and calf stretching. I encourage everybody who's watching to do these along with us, and if you have any questions, we'll be happy to answer. All right, so we're gonna go ahead and get started.
Okay, so to begin, we're going to be discussing exercises for lymphedema of the upper extremity and the lower extremity. But before we do either, we want to make sure that we work at the core first. This looks like a technique we call diaphragmatic or belly breathing. Now you want to hear on the screen is going to demonstrate how that goes. First, she'll start by sitting nice and reclined in a chair with good posture, but very comfortably. And she's going to place one hand on her chest and the other hand on her stomach. Now, these two hands are going to be used to help cue and make sure that we're activating the right muscles when we're inhaling and exhaling. With inhalation, you are going to envision that you are pushing your bottom hand away from your stomach. So you're going to fill your stomach like you're filling an air balloon. Inhale, and then exhale. Now, if you feel like the hand that's on your chest moved more than your bottom hand, that means you're breathing with your chest, and we want to try to bring that movement down to the stomach. So again, we're going to try inhaling one more time, moving the bottom hand more than the top hand. When your stomach puts pressure on your bottom hand, that's how you know that the breathing technique is working correctly. This belly breathing activity activates the lymph nodes. If you begin to get lightheaded during this procedure, at that point you would stop and allow yourself to breathe regularly for the time being until those feelings pass. Now again, Joanna is going to demonstrate 10 belly breaths. 1. Good. 2. 3. 4. 5. 6. 7. 8. 9, 10. Good. And now that exercise can be repeated as long as you feel comfortable. It's a great foundational exercise for everyone to then move on to working on the different limitations that might be caused by lymphedema in the extremities. The next exercise we're going to talk about is upper extremity lymphedema. So the exercises that we'll start with are wall slides. This is useful for maintaining upper extremity range of motion. So useful for helping people who might not be able to reach up overhead. And so she's going to put her hand on a wall in an open doorway and slowly glide the hand up the wall, providing a gentle forward pressure. This stretch at the very end is comfortable and should not hurt at all, but it is important for helping the patient to maintain their range of motion when reaching up overhead. She'll perform this 3 by 10 times, but for today, we'll just start with 10 with a slight hold at the very top, maybe 3 seconds. 1, we encourage everyone to follow along with us. And down. 2. 1, 2, 3. 3. 1, 2, 3. 4. 1, 2, 3. 5. 1, 2, 3. 6. 1, 2, 3. 7. 1, 2, 3. 8. 1, 2, 3. 9. 1, 2, 3. And 10. 1, 2, 3. Wonderful. And now that our overhead movement is starting to improve and we've started to loosen up the chest, we're going to move on to another activity called pectoralis stretching. So the pecs are the muscles of the chest, and this also requires an open doorway. And so Ioana will stand in the doorway with both hands on either side. Gently, she'll step forward with one leg, either leg that you prefer, and she'll begin to feel a stretch along the front of her chest. This pectoralis muscle can sometimes get tight, resulting in our shoulders being held very forward, making it difficult to move the arms overhead. This stretch helps to adjust that and prevent any sort of contraction that may come as a result of breast cancer surgery or lymph removal. This activity can also be done in holds, so she'll hold for 10 seconds here, and we'll just show it twice now. Okay, 1 Mississippi, 2, 3, 4, 5, 6, 7, 8, 9, 10. And she can relax, kind of shake the shoulders out a little bit before she does it one more time. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. If at any point that stretch becomes uncomfortable on the shoulders or on the elbows, you're welcome to bring your arms slightly lower on the wall so as not to reach overhead. The last exercise we're going to discuss is called towel squeezes. A towel squeeze is done to maintain the strength of the hand, as well as to improve the return of the fluid that's down in the fingers, hand, and forearm. So Ioana will demonstrate that by taking this towel that we've rolled up into a nice cylinder and providing a 4-second squeeze 10 times. 1, 2, 3, 4. and then relax. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. And our last one. 1, 2, 3, 4. Wonderful. And so those are the first exercises that we would teach a patient living with upper extremity lymphedema. We'll now transition to demonstrating and explaining a few exercises for lower extremity.
All right, so for the lower extremity exercises, we are going to start with heel raises. So heel raises are important because they activate the muscles in the calf and the muscles in the foot. And as we talked about, these muscles help drain the fluid in the limb. So for heel raises, what we're going to do is you're going to push up on your toes, nice and slow, and then come down nice and slowly. So we're going to go ahead and do these 10 times. Everybody, let's go ahead and stand up and let's get started. All right, Sean, are you ready? All right, so let's, number 1, 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good job. Next, let's go ahead. We're going to do some ankle alphabet. So go ahead and take a seat in the chair, Sean. These exercises, again, are really good if you notice if you have any swelling in the lower portion of your leg. And this is a nice exercise because you can do it sitting at a table, on the couch, throughout the day to kind of get blood moving and to help, again, the muscles pump out that lymph fluid. So what you're going to do is with your toes, you're going to trace out the alphabet as best as you can. So we're going to do all the letters in the alphabet. Let's go ahead and start with A, nice and slow. B, C, D, E, F, G, H, I, J, K, L, I, sorry, M, N, O, P, Q, R, S, T, U, V, W, X, Y, and Z. So ideally we would have you do 3 sets of these at home, but for the presentation we will only be doing 1 set. The next exercise is a calf stretch. So I'm going to have Sean go ahead and stand up. So when you're in the calf, we have 2 muscles. One is called the gastroc, the other is called the soleus. So we're going to be stretching both of them. For the first one, Sean's going to have 1 foot in the back and 1 foot in the front. The back knee is going to be straight. He's going to go ahead and lean forward, trying to get a stretch in the back of his calf. So we're gonna go ahead and hold this 10 seconds and we're gonna do it 3 times, okay? And make sure to keep that heel in the back on the ground and make sure your toes are pointed straight forward and not off to the side. So let's go ahead and do our first repetition. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Go ahead and relax. All right, we're going to do the second repetition. Go ahead and lean forward, Sean. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, and last one. Go ahead and lean forward. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And also, if you want, you could have a counter or a wall in front of you. If you want to lean into it, it could make the stretch a little bit easier. So the next stretch is going to be the gastroc. You should feel this stretch a little bit closer to your heel and your ankle. So instead of that back leg being straight, we're going to go ahead and bend it, and then you're going to lean forward. Very good. So let's go ahead. We're going to do 3 more repetitions of these. So you're going to bend that back knee forward and then lean forward. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Take a little break. Go ahead and lean forward for number 2. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, and last one. Go ahead and lean forward. Good. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good job. So doing these stretches, we would recommend doing it anywhere from 5 to 10 times and trying to hold it for about 10 seconds. You are welcome to hold it a little bit more. These stretches should help loosen up the back of the legs and get blood moving and the tissue moving as well. So now we're going to go ahead and do some Q&As with Kathleen.
All right. Amazing job, guys. So we are going to start with a question. Sean and Alana will stay on. Let's chat about what the difference between lymphedema and edema is.
Okay. So the difference between lymphedema and edema is that set as the origin of the issue. Lymphedema is caused by, again, it's a malformation or an issue going on with the lymphatic system itself. Now, edema can be caused by any number of things. Very commonly, we'll see it with muscle or joint sprains and strains, and that is the body sending vessels or sending fluid to the tissues in order to provide healing and nutrient-rich material to the area for healing. Now, edema is temporary and it is unmanageable, oftentimes just with elevation or ice and, low-level exercise, but lymphedema is a pathological change to the tissues. So it's a little bit more in depth and therefore requires more specialized treatment.
Amazing. Thank you. All right. So speaking on obviously lymphedema, when would you do manual lymph drainage versus the wrapping that you guys were talking about?
So you would ideally do both in conjunction. So the manual lymph drainage helps drain the lymphatic fluid from the limb, and then the compressive tissue will help maintain that limb in that without the drainage in it. And both in conjunction should help with lymphedema treatment.
Great, thank you. All right. Next question, and if anybody has questions, still feel free to put them in the Q&A. But our next question is, how long would I need to complete those exercises that you showed before in order to see results?
That's a really great question. So the question being, how long would you need to perform these exercises in order to receive results? Now, doing those exercises alone with lymphedema might not be enough to see results, and that's why it's important to make sure that you're taking care of this in conjunction with the other techniques. Now, the exercises can offer immediate results if the body is already kind of prepped and primed. So that's having done your belly breathing, your manual lymphatic drainage, and wearing your compression sleeve. And then the benefits of that are maintained by the garment itself.
Amazing. All right, next question. So how much can elevation help? Like a raised foot of a bed, recliner, inversion, any of that stuff?
So elevation is useful for the first, I believe the first two phases of, the first two stages of lymphedema. In the picture where we talked about manual lymphatic drainage, there were different levels of lymphedema. And so for those first two stages where the swelling is not quite so severe, elevation is helpful in the short term, as well as helpful with edema itself, not lymphedema. Then after a certain point, once the body starts to have fibrotic changes, so tissue changes to the limb, then the elevation becomes less helpful.
Amazing, thank you. I had to dodge my cat. He was wanting to get a little involved. So next question, how safe is it to stimulate lymph flow or drainage if you have a heart condition?
So one of the contraindications is chronic heart failure. What I would recommend is definitely asking your medical provider if manual lymph drainage is safe to do. And then if that isn't okay, then it would be safe. Otherwise, I would hold off just to double check.
And then we have another question. So is it okay to do other workouts when you're receiving therapy for lymphedema? Or to do any other types of physical activity?
Yeah, and it's actually recommended to be physically active if you have lymphedema, because like we mentioned, moving those muscles helps drain the fluid, it helps move the fluid. It's also very healthy. Maybe certain exercises should be avoided, like maybe heavy lifting using that limb or things like that. But I would definitely just double check with your provider. I'm sure it would also matter what staging of lymphedema you're at. Do you have anything to add to that, Sean?
Nope, nothing especially. The only thing I might mention is that research does show that low impact exercises are shown to be quite helpful. So that would be like repetitive biking, swimming, or taking comfortable walks. All of those would also be safe for you to perform. Oop, Kathleen, we have you muted.
I got muted. So, all right, the next question, what about compression stockings? This person is saying, I wear 20 to 30s on my calves, but I can't imagine having to wear full leg stockings regularly.
So that is something that we do talk about in lymphedema training and lymphedema therapy. 20 to 30 millimeters of pressure is kind of what's recommended for maintaining fluid volume in the limb. Now, it can get uncomfortable the higher pressures that we give. And so a big part of finding the right garment for the patient is kind of figuring out what is something that is feasible and will fit into their lifestyle. How is their hand function? How is their ability to reach the limb that needs to be compressed? And so if that is what they can handle, then that's kind of what we would then recommend. However, sometimes it is necessary to provide more compression in order to maintain a more significantly impacted limb.
Yeah, and is that something that you guys as physical therapists can help the patients figure out as well?
Yeah.
Yeah.
Nice. All right, next question. Would a rocking chair help to gently stimulate lymph flow, or even a trampoline?
So my initial instinct is to say, well, no one's ever asked me that question before. My initial instinct would be to say a lot of the lymph tissue needs to be stimulated by physical touch and sensation. So the gentle movement of a rocking chair may not be enough in order to stimulate that gentle lymph flow necessary. So a typical massage would look similar to just kind of gently tugging at the skin, whereas the movement of the rocking chair or the vigorous jumping of a trampoline might not activate that very superficial level needed to activate the lymph. Joanna, anything else you want to add?
No, I've never been asked that question
Yeah,
either.
great question. I love the curiosity.
No, I feel like trampoline workouts are like the new really cool thing. So I was curious too when I saw my question.
Very cool.
All right. So next question, should lymph drainage be done in the morning or the evening? And can you wear clothing or should it be done on the skin? While there, I guess, can you wear clothing while you're getting a lymph drainage?
Lymph drainage has to be done on the skin. Whether it should be done in the morning or in the evening, I would say probably in the morning would be best, but I don't think there's any specifications to what time of day. Do you know of any, Sean?
Yeah, so my understanding is that the lymph drainage should always be performed prior to wearing a compression garment. Now, in complex decongestive therapy, during the day, a patient would wear a compressive sleeve, and then at night would then wear compressive wrapping. And so long as the drainage is performed before the wear of either of those two materials, that would be the best time to perform it. So maybe twice a day, depending on severity or need.
All right, next question. Are vibrating platforms good for the lymphatic system? And if so, how long would you recommend and to what intensity?
Truth be told, I've never seen any research on whether or not a vibrating platform is something that was been used to treat lymphedema. I don't have an answer for that. Joanna, do you?
I do not as well, but like we have mentioned, doing the light touch is what helps drain the lymphatic fluid, and vibrations, you're not really doing, there's no touch being performed, but it could be, that's something we could look more into and follow up.
Yeah. I will also say that this sequence of lymphatic drainage does need to happen in a very specific order of events. And so a general vibration of the body might move lymphatic tissue or lymphatic fluids, but not in a particular direction, and therefore we wouldn't receive that benefit.
That makes a lot of sense. Okay, the next question, can people who don't have lymphedema do these exercises that you guys went through?
For sure.
Absolutely. Absolutely. So any of these exercises are great for maintaining flexibility, calf strength, arm strength, and movement. We prescribe these exercises to all sorts of patients, I find.
Yeah, same.
Mm-hmm.
Amazing. All right, next question. They're coming in. Is it okay to get the manual lymphatic drainage if an individual has difficulty with putting on or taking off the compression garment due to a condition or diagnosis like a stroke? So I guess you had mentioned wearing the compression garment after receiving lymphatic drainage is important, but can a patient receive drainage if they cannot follow up with the compression garment?
Yeah, so they should still be able to benefit from the drainage, even if they can't put on a garment after or compression after. It should still definitely help. And one of the signs that we see is after we do the manual lymph drainage, patients usually have to go to the bathroom because of the fluid drainage.
Very interesting.
We didn't mention it.
That is a fun fact. All right, I think that is all of our questions. If anybody has any pressing questions, any last questions, you can go ahead and put them in the Q&A. Oh, we got one. How many months should a sleeve and gauntlet be worn?
Great question. Do you want me to answer?
Sure.
Okay. So in terms of the complex decongestive therapy programs that we perform, the pre-fitting, so that would be the phase 1 of treatment, that can last anywhere from like 5 to 8 weeks. At which point the transitional happens when 1, the patient is ready to kind of self-manage, and 2, once the volume of the limb has plateaued to a certain point. So we're not seeing that benefit from the continued wrapping and drainage and exercise, all continuously bringing the limb down. Once that happens, phase 2 is about long-term management. And so they would be wearing that garment as part of their daily wear every day, day and night. It is something that does need to be managed until we find a long-term solution for this condition.
Perfect. I think we've got one last question. I know we had discussed for patients with cardiac conditions to obviously discuss with their provider. Is there a reason that somebody who has a heart condition, if they shouldn't do these exercises, or is it more the manual lymph drainage that you guys were talking about?
It's more the manual lymph drainage because we're moving fluid to the heart. So if somebody has a heart condition, it might, affect that. So it would be good to double check, but the exercises are great for everybody.
Perfect. All right, amazing. We got one more. These keep coming in. Can you wear compression garments while doing the exercises? That's a great question.
Yes, and it's recommended that you wear it when you're doing the exercises.
Cool. It sounds like that would give it the most benefit, right?
Definitely.
All right, so I think that is it for Q&As.
Someone mentioned in the chat asking if lymphatic drainage is something we do here at Spear.
Oh yeah.
And so Joanna and I, the reason we kind of connected on this topic is because we've both kind of been practicing and learning, working towards certifications and being able to do this kind of activity. And so theoretically, yeah, if you come on in, we do take patients for lymphedema.
Definitely.
That's awesome.
Mm-hmm.
All right, so that is it for Q&As. We hope today's talk was valuable and that you learned more about lymphedema and some treatment methods. If we didn't get to your questions, or if you start to think of questions later, you can always reach out, but we will be sending a handout after the webinar to recap those exercises, so you have a reference. And then as a reminder, your presenters today were Owana Carty and Sean Alasso. And we had Sarah Shoemaker behind the scenes with all those questions at the end, which we love. She is our assistant clinical director at the Chambers Street location. And I'm Kathleen with Spear Live. So you can reach out to any of us if you have any questions or if you need help getting set up with a therapist. We're happy to facilitate getting you to the right therapist. And then at Spear, we treat an array of conditions from head to toe. As a reminder, we are open for in-person visits as well as for telehealth visits. If you feel like you could benefit from individualized guidance and treatment, don't hesitate to reach out to any of us individually. We can personally coordinate you with the right person. And I know before I said we had 21 clinics, but look, we got 24. We keep opening and popping up everywhere. So we are going to be doing webinars throughout 2022, covering a variety of topics. So we look forward to seeing you there. Please follow us on social media, check your inboxes for more topics. And if for some reason you had any difficulty with what the view was showing or any audio, we do have that YouTube link that we sent out in the chat. It's still there, and you can see any of our other webinars on our YouTube channel as well. So thank you so much for spending time with us. We hope you enjoyed the webinar, and we